So, Robaxin-750 is a medication used to treat muscle spasms and pain. It is typically used in combination with rest, physical therapy, and other treatments. The medication works by helping to relax the muscles. When taking Robaxin-750, it is important to follow the recommended dosage provided by your healthcare professional. It is typically taken 3 to 4 times a day, and the best time to take it is usually with food or milk to minimize stomach upset. If you have any concerns or questions about taking Robaxin-750, it is important to consult with your doctor for personalized advice. When taking Robaxin-750, it's important to follow your doctor's instructions. You can take this medication with or without food. It's crucial not to increase your dose or use it more often or for longer than prescribed, as this can increase the risk of side effects. The dosage will depend on your medical condition and how you respond to the treatment. Make sure to inform your doctor if your condition doesn't improve or if it gets worse. This medication is used to help relieve muscle pain and discomfort caused by strains, sprains, or other muscle injuries. It is best to take Robaxin-750 at the same times each day to help you remember. Some common side effects of Robaxin-750 may include drowsiness, dizziness, lightheadedness, stomach upset, nausea/vomiting, or blurred vision. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. It's also worth noting that many people who use this medication do not experience any serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects such as persistent nausea/vomiting, fainting, slow heartbeat, yellowing of the eyes/skin, or changes in mental/mood, such as confusion or forgetfulness. While it's rare, a very serious allergic reaction to Robaxin-750 can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing, seek medical help right away. This is not an exhaustive list of potential side effects, so if you experience any other effects not mentioned here, it's important to contact your doctor or pharmacist for further guidance. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Robaxin-750, make sure to inform your doctor or pharmacist about any allergies you may have. This medication could contain inactive ingredients that may cause allergic reactions. It's important to discuss your medical history, especially if you have liver disease. Robaxin-750 may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana as they can intensify these effects. It's important to refrain from driving or operating machinery until you can do so safely. If you are using marijuana, talk to your doctor about it. Before undergoing any surgery, inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. Older adults may experience increased sensitivity to the side effects of Robaxin-750, which could include confusion, dizziness, or drowsiness, leading to an increased risk of falling. If you are pregnant, use this medication only if necessary and after discussing the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Robaxin-750. Always keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Let them know if you are taking any other products that cause drowsiness, such as opioid pain relievers, alcohol, or drugs for sleep or anxiety. Also, be cautious of using other products that may cause drowsiness, like allergy or cough and cold medicines. It's important to ask your pharmacist about using these products safely. Additionally, Robaxin-750 may interfere with certain lab tests, potentially causing false results. Make sure to inform your lab personnel and doctors that you are using this medication. If someone has taken too much Robaxin-750 and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness or dizziness, seizures, or loss of consciousness. It's important to seek medical help immediately if you suspect an overdose. It's important to remember not to share your medication with others. Robaxin-750 has been prescribed specifically for your current condition, and it's not recommended to use it for any other condition without your doctor's direction. If you need medication for a different condition, your doctor may prescribe a different medication for that purpose. If you forget to take a dose of Robaxin-750, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Robaxin-750, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom and to keep it out of reach of children and pets. When it comes to discarding Robaxin-750, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. As for the optimal timing of taking Robaxin-750, it's best to follow the dosage instructions provided by your doctor or pharmacist. Typically, it's taken 3 to 4 times a day, and it's important to take it at evenly spaced intervals. This medication can be taken with or without food, but it's important to be consistent with the timing and dosage to get the most benefit. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.